This is class seminar patient interview project.
Hello, Mr. Jones. My name is Dr. Ahmed. I'm gonna ask you some questions. What brought you here today?
Well, I was feeling short of breath and I started to have some tightness feeling in my chest, so
How long have you had this problem?
it started this morning right after I got up.
What do you do to relieve your symptoms?
I didn't know what to do, so I called the ambulance.
Are these symptoms related to any other location on your body?
Just mainly around my chest.
Okay. Do you cough a lot?
Yes.
Can you describe your cough?
It feels like an irritating feeling in the back of my throat.
Okay. Do you have any infections in your ear or your respiratory?
No, not that I know of.
When you cough, do you cough up blood?
I've coughed up blood before, yes.
Do you have any pain in your chest or
Yes, in my chest.
on a scale of 0 to 10, describe that pain?
11.
Oh, that bad.
Yes, it's pretty bad.
Do you smoke?
Yes, I smoke.
How much do you smoke?
About a pack a day.
And how long have you smoked?
For about 20 years.
Has anyone ever told you that you snore loudly when you sleep?
I live alone.
Now, I'm just going to ask you some general symptoms. Are you short of breath?
Yes, I am right now.
Do you have any wheezes?
Yes.
Do you have difficulty sleeping?
I have difficulty staying asleep.
Now, I'm just going to listen to your lungs. Yeah, it seems like you do have some wheezes right now. Mr. Jones, when you exercise, do you have any symptoms? Do you feel short of breath or anything like that?
I don't exercise, but usually whenever I take long walks with my dog.
Okay. Are your symptoms, are they triggered by anything? Any other activities you do?
No, not really.
How about your job site? Does that trigger anything?
Well, what do you mean when you say symptoms? Like my chest pain? And my coughing?
Coughing, shortness of breath.
No, it usually comes and goes.
Have you been to the hospital in the past year?
Yes.
And what was it for?
Short of breath. I couldn't take in a big breath, so I had to call someone to take me to the hospital.
Has this problem caused you to miss work or school or anything?
Yes, it has.
How long has it caused you to miss? A couple of months, couple of weeks?
About a couple of days in the week.
So how many times have you been to the doctor in the past year?
I have to say about once.
Sir, do you take any medications or anything?
Well, I'm on a couple of inhalers, and I'm taking insulin and blood pressure medicine, but that's all I can remember.
Your inhalers, do you use them frequently?
Well, the doctor gave it to me the last time I was in the when I went to see the whenever I went to see the doctor but I don't know. I just didn't feel like it worked, so I didn't use it after that.
Okay. Taking high blood pressure medication and insulin, you said, right?
Yes.
Alright, Mr. Jones, it's good meeting you, and I'll be back shortly with your diagnosis and your medications.
Thank you, doctor.
In this video you just saw, we demonstrated how to perform a proper patient interview. It is important to maintain professionalism while keeping the patient comfortable.
As you saw earlier, Dr. Ahmed addressed the patient by his first name, which was proper and it showed respect for the patient. He also asked questions pertaining to patient care in order to properly diagnose, and treat the patient. We hope this video gave you a general idea of how to conduct a professional interview, and we thank you for your time.
When you exercise, do you have any other symptoms? Do you feel short of breath when you exercise or anything?
I don't exercise, but usually whenever I take long walks, my dog Fluffy.
Does that irritate you? Your dog? Now I'm just going to ask you a couple questions about medication. Are you taking any medications?
No, not at the moment.
How about for your asthma, for your wheezing? Are you taking any inhalers?
No.
Yes, you are.
Whoops. I mean,
What about that Advair right there? Just start over.
Am I supposed to be taking medication? I thought I was doing untreated.
All right, Mr. Jones. Nice meeting you.
Oh, thank you, doctor. Nice meeting you too.
I'll be back with your diagnosis and your medications, and we'll send you home. Okay?
I hope so. What's that smile for?